Yeah, thanks. Bibiana, go ahead.
Okay, so as I was saying, I'm very glad to share this presentation with all of you, and I hope it's useful and that we can find ways to work together in the future. So let me start. So the first thing that I want to clarify is what is it that we wanted to learn with this evaluation. So why did we do the effort to go ahead and evaluate a program that was already in place? So the first thing that we wanted to know is, was the program working? So was the program effective in improving youth employability? And what do we mean by youth employability? So whether youth had higher probabilities of being employed, had higher probabilities of having a job in the formal market, and had higher earnings. So that was our main questions. Was this program for at-risk youth effective in improving youth employability? But this was not the only thing that we wanted to learn. We also wanted to learn through which channels was this happening or not. So if we saw improvements in employability, why did this improvement took place? So we explored several channels. And among these channels, we had cognitive skills, more related to traditional IQ measures of intelligence, learning, etc. Non-cognitive skills, which are sometimes known as life skills, basic skills, socio-emotional skills. And then changes in behaviors, for example, behaviors related to higher productivity or behaviors related to risky activities. And then perceptions and expectations. So that is, how do youth see themselves and how do they think of themselves in the future? And why did we wanted to learn all of this? So basically, we wanted to know if there was a way to improve the program, and actually if we should or not continue this type of programs. As you know, like youth employability is a big challenge everywhere, and we're always looking for solutions or ways to solve this problem or to improve the way we try to solve this problem. So that this was the objective of the evaluation. So how did we set up the learning process? And here the first thing that I want to say is that we were very lucky because we have a counterpart that was really interested in the evaluation and was very flexible in allowing us to do the evaluation and in collaborating with us with the evaluation. So they, as you might be aware, the best way to evaluate a program is by doing an experiment. So the counterpart that we had in this program was flexible enough to allow us to. Hello, are you hearing me?
Yes, we can hear you. Yes. Don't worry, we hear you very well.
Just to make sure I'm not talking to myself.
Talking to you, it sounds like you're talking to yourself. No, we can all hear you very clearly. It's actually the clarity is amazing.
Okay, perfect. So as I was saying, we were very lucky because our counterpart allowed us to do a randomized experiment from the very beginning, and this allowed us to carry on a very effective feedback loop between the evaluation results and the program design. So what happened is that the program, we designed it, or actually I wasn't part of this initial design in 1999 or something like that. And and it started implementation around 2001. And from the very beginning, it had a first round of evaluation. That first round gave feedback to the program that made important adjustments to the design of the program. Based on that, we reevaluated, and that's the evaluation I'm going to talk to you about. And based on that evaluation, again, we gave feedback to the program, they adjusted again, and another evaluation is now going on. So it's like a piloting, like a learning process of almost trial and error, where we have been able to make a lot of adjustments to the program based on the results of this very rigorous evaluation process. So for this specific evaluation, we were able to randomly assign individuals to 2 groups. So one treatment group and one control group. And the way this works is that for each course, let's say each training center had the possibility of opening to people to subscribe to the course. And once they had a number of people already listed for the course, they selected 35 people, and from those, let's say 35 eligible people, from those 35 people, they sent it to the central coordinating unit of the project. And over there, we randomly assigned 20 of those people to the treatment group and 15 of those people to the control group. And we did that for each course in each training center. So in total, we had almost 6,000 people in the treatment group and about 4,000 people, a little bit more, in the control group. From those, we took a sample for the evaluation. As you know, most of these evaluations are based in doing home surveys, so they're expensive, so we couldn't survey everyone, but we had a large enough sample to be able to detect important effects. So let's continue. So before looking at the results, let me tell you what is the Juventud y Empleo program exactly about. So this training program for at-risk youth consists in 2 main components. So first, it has classroom training. This classroom training has both training in vocational technical skills and has training in these life skills or non-cognitive skills. So in total, there were about 225 hours of training, of classroom trainings, of which I think it was 175 hours of vocational training and about 75 of life skills training. The vocational training was traditional vocational training in different sectors. As you know, Dominican Republic has a lot of tourism, so there was a lot of training in that sector. There was a lot of training in services, beauty services, let's say retail services, some also mechanical, more technical services, or let's say skills. And then there was the life skills component, which was also classroom based. And then after that, there was an internship at the private sector, which was supposed to last about 3 months. So this was the first characteristic of the program. Then what other important characteristic does the program have? So it's targeted at-risk youth that are between 16 to 29 years old, that have not completed high school, that at the moment of the program are not studying or working, and that hold some ID card, some government card. So as you can see, the youth that we targeted with this program was, let's say, quite challenging, because they're really disadvantaged youth that have very few education, very few previous work experience, that sometimes are already unemployed, and that are generally located in very poor areas of the city. The last characteristic of the program that I would like to highlight is that the program worked very close with the private sector in 3 different ways. So first, there was a close communication with the private sector in order to decide the content of the training session. So what were the actual demands of the private sector for labor in order to decide in which sectors to train the youth. The other thing that was very close with the private sector was that it was private sector providers that gave the training. So it was not government providers, but private sector providers who gave the training sessions. And finally, it was the private sector that offered the internships for the youth. And okay, before showing the results, many of you might be wondering, okay, is there something special about the Dominican Republic that I need to know regarding their employment situation, their youth situation? And here what I would say is that not really. So as many countries in the world, Dominican Republic faces a huge challenge in terms of youth employment. But again, it's basically the same situation or very similar situation that many other countries in the Latin American region, and I guess then in many other places in the world. And what's the situation? So about a third of youth are unemployed, or let's say not unemployed, but not working or studying. Youth employment is more than twice than adult unemployment, and youth informality is about twice of adult informality. So very challenging situation, but as challenging as in many other regions of the world. And here are some characteristics of the youth at baseline. So as you can see, they were on average aged 22 years old. About 60% were females. Most of them, about 85%, had not completed high school. Only 20% had prior work experience. About 50% were already unemployed. And most of them, about 90%, were in urban areas of the country, of which a third of those was in the capital, Santo Domingo. So let's turn to the results. So what did we learn? Was the program effective in improving youth employability? So the first thing we looked at using a survey that we carried out about 2 years after graduation. So this is important because there are somehow midterm effects. We did not do the survey just after graduation. We waited 2 years. So these effects here are quite persistent, let's say. And the first thing we looked at was, of course, employment. And unfortunately, in employment, we didn't find any effect. Actually, as you can see in the graph here, let me see, it looks just a minute, it's very small for me, so I'm going to. So as you can see here, actually the treatment group was a little bit worse off than the control group. They were 2 percentage points less likely to be employed. However, these results were not statistically significant. So what I would say is that the program did not have an effect on employment. On average, treatment and control individuals were as likely to be employed. So this first result was a little bit disappointing, but we kept on looking on other results related to youth employment. So we looked at different measures of formality. The first measure that we looked at was whether youth were employed with a written contract, and here we do see an effect. On average, youth in the treatment group are about 2 percentage points more likely to be employed with a written contract, and this effect is even larger for men. We also looked at another measure of formality, was to see whether they were employed with health insurance. And here again, we see an important effect, 4 percentage points for the entire sample and 10 percentage points, so that's about a third so a 30%, about 30% impact in men. So that's quite a large impact. All of these effects are statistically significant. So even though there is not an impact on the probability of being employed, there is an impact on the probability of having a job in the formal sector. And this is confirmed by 2 different measures. We also find among those that were already employed that those that had participated in the program had higher earnings, so 9% higher in the overall sample, 14% higher for women in the overall sample, and these effects were even higher in the capital, in Santo Domingo, and specifically in the capital, they were very high for men. So about 20% increase in earnings among those employed in the capital for men. So, as I just said, unfortunately, the program didn't have any impact on overall employment, but it did have impact on formal employment, very marked for men, and it also had impact on earnings. So what we can conclude of this slide is that, okay, the program has mixed results on employment. It does not seem to increase overall employability. However, those that do get a job get a better job. Yeah, so quality of the job does seem to increase with the program. And as I said before, our interest was also in learning how these changes happen. So we looked at some of the channels that I had mentioned before, and what did we find? So through which channels did these results in employment happen? So first, increasing some desirable behaviors and decreasing other behaviors less desirable. So specifically, seem to increase. They seem to be more committed to seek for a job and seek perhaps better job. And what else? Looking at not or risky behaviors here, we found a very important impact in pregnancy, and specifically in teenage pregnancy. This I think is a very important result. As you can see from the graph, girls that participated in the program were 2 percentage points less likely to be pregnant at the moment of the survey, so 2 years later, and teenage girls were almost like 40% less likely to be pregnant. And here I would like to highlight this result because some of the channels are only valuable to the extent that they have an effect in employment. So we don't, the fact that youth are seeking for a job, more hours, is only valuable to the extent that they can get a better job. It's not a result in itself. But pregnancy, I think, is a result in itself. Even if girls do not get a job because they're less pregnant, the fact that they are not pregnant at 16 has some value, at least in countries like Dominican Republic, where teenage pregnancy is very high, and most of those pregnancies are undesired pregnancies. But let me continue exploring the other channels. So which other channels did we see changing? So as I said before, expectations about the future change. So basically, youth thought about themselves in the future highly. They thought they would have a better health, better education. They thought youth in the treatment group were more likely to think that they would own a business than those in the control group. They had higher professional aspirations. In general, they thought they would have a better life than those in the control group, and would have a higher, let's say, a better wealth position in the future. And the other channel that did improve was non-cognitive skills. So we measured non-cognitive skills through 3 different scales. The CPS scale, which is a scale we developed specifically for the program, and that measured leadership, conflict, self-esteem, relations with other, organization, and here we did find important impacts too. We measured non-cognitive skills also through the Rosenberg scale, which is a scale using clinical psychiatry to measure self-esteem. We also find important impacts in self-esteem, and we use the grit scale, which is another scale used in this type of test or assessment that measures persistency of effort and ambition, and there we also find important impacts. So a question that we might be asking is whether the program impacts everyone in the same way. So were the younger ones better than the older ones, or men versus women? And so let's look a little bit at those heterogeneous effects in different aspects. So between men and women, we did find some differences, but there are important impacts for both genders. Informality impacts seem to be better for men than for women. However, in earnings, they seem to be better for women, as seem to be for perceptions and expectations, and for non-cognitive skills. Looking at location, the higher impacts, at least in formality and non-cognitive skills, seem to be in Santo Domingo, the capital. And looking at age, it is the younger youth, those that seem to take the most advantage of the course, of the training. Specifically, they seem to have better results, to say it in some way, in perceptions and expectations, and in non-cognitive skills. So some results seem to reinforce the idea that younger youth and women are those that take the most advantage of this type of training. So what are the policy implications of this evaluation? So the first policy implication is related to the employment or the labor market results. And as I said before, these kind of trainings seem to be very effective in improving quality of employment for at-risk youth. Specifically, as we saw, the program has positive impact in formality. This impact is about up to 52% in some cases. And it also has, among those employed, a positive impact on earnings. This impact goes up to 17% in some groups. Another policy implication of the evaluation is that there are several channels through which these results might be triggered. As we saw, behaviors, so incentivizing positive behaviors and disincentivating negative behaviors, increasing expectations, and increasing non-cognitive skills. And finally, as I highlighted, some of these channels might be an objective in themselves. So specifically pregnancy, as I said, the resulting pregnancy is very valuable. And as we saw in the case of teenage girls, pregnancy decreased in 43%, which is quite huge. Finally, I wanted to say that these findings are somehow consistent with previous research on this topic. Yes, here. I'm thinking how to say this, because it is very difficult sometimes when we do these evaluations, we would like to have a result that is so determinant that we can apply it everywhere and not have to evaluate anything in the future, or just like to have a magic bullet that will allow us to do perfect programs. But that is not the case. So the way we have to take these results is with some caution, but trying to learn as much as possible. So as previous literature shows, this evaluation also shows that there is limited impact of this type of programs on employment, but there is significant impact on quality of employment, specifically on formality and earnings. And that these effects do change between the subpopulations we try to impact. Something very important and that has taken more and more value in the literature is the importance of non-cognitive skills. Examples of previous literature, as I said before, the program itself, Juventud y Empleo, was already evaluated, and the results are somehow similar, though our results are stronger. Another research in the region in Latin America shows similar impacts. There's a program here in Colombia called Jóvenes en Acción that has somehow similar impacts, though a bit more determinant for employment, specifically for women. And there's also, as I said, growing literature on the thing of non-cognitive skills. So can we apply these results to other developing countries? As I was saying, yes, but with caution. You always have to analyze how your context compares to the Dominican Republic context. And of course, you have to keep testing in order to continue learning and continue improving the programs. So before closing, I just wanted to say something about the things that we still don't know. So mostly I want to focus this on non-cognitive skills. So we have learned that non-cognitive skills seem to be important in changing youth performance in the labor market. However, there's a lot of things that we still don't know, a lot of noise on how these non-cognitive skills are actually important and the type of role that they have. So what do we have to learn? What do we still need to learn? So first, which specific skills are positively related to labor market participation? So is it leadership? Is it self-esteem? Is it ambition? Is it organization? So what is it that really impacts labor market performance of these youth? By how much do we have to change these skills? So a little bit, a lot. How do we measure the magnitude of these non-cognitive skills, and by how much do we need to change it? And finally, how do we train for these type of skills? Which training program designs can be effectively replicated and scaled up? So is it in classroom? Is it practical, theoretical, applied? What type of content? How long? How many hours? All these type of things we need to fine tune. And finally, how do we measure these skills? As I said, we used in this evaluation 3 different types of measures, but are these good measures? Are they bad? How much do we have to change in those skills? So this is learning that we still need to do and that our research agenda should address. So I think that's it. I hope that it's useful, and I'll be happy to answer any questions
Thank you
that you might have.
Yeah, we can hear. Thank you, Bibiana. Appreciate it. It's our first try at using the link meetings. So I know some colleagues were having difficulty joining, and so that has also been an issue. But appreciate it, and especially appreciate because we are now within our region starting to focus on looking at how do we integrate measurements into our various skills development programs. and actually have hard data as we move along the process to see whether things are working or not working. So what I will do is open it up for colleagues for any questions. And when you want to do a question, just unmute your mic so we can hear you. Why don't you come to this side? There's a colleague here who has a question. Just a second. Yeah, you can introduce yourself.
Hi, this is Liv. I'm a colleague in the regional office on the adolescent program. Thank you so much for your insight to your program and the evaluation results you found. I just wanted to see if you could elaborate a little bit more if you have found out why the program didn't really make a difference in terms of number of employability opportunities for the participants in the program. Because I find that the qualitative results you got in terms of those who did get employment are very good and clearly defined, but do you know why you were not able through the program to show an impact on more employability opportunities? Can you hear me?
Yes.
Okay,
Yes.
thank you.
So I would say two things. First thing is that these programs are based on the assumption that the economy is creating the jobs, or that there are vacancies in the economy to fill in those jobs. So there's a macro issue that might be affecting here. It might be the case that there are not enough vacancies, and that what is going on is only displacement of those vacancies or of those job placements that already exist. So that is also something that we have to take into account, that even if we train these youth the best we can, but the economy is not growing or is not creating jobs for these youth to take once they graduate for the program, it's going to be very difficult, because probably what's going to happen is that they're going to have to compete or to displace youth that or some other people that are already in their jobs. So that's one thing that might be happening in some of these programs. The other thing that we thought might be happening is that these youth are looking for better quality jobs. So, and this is related to the fact that they look for jobs for a longer time, so they remain unemployed. We also have that measure. They are unemployed for longer periods than youth in the control group. So apparently what could be happening is that they have somehow like a higher either reservation wage or a higher expectation. So they don't take the first job they're going for, but they wait a little bit longer until they take a higher quality job, a better quality job. So this is something that might also be happening, and that overall doesn't allow us to see impact on employment. But it is not, perhaps it's not because the youth are not getting employment offers, but because they're not taking the first employment offer they get. They expect something better and wait until they find something better. That's a hypothesis that we have that is hard to test, but that could be reinforced by the fact that they do seem to last a little bit longer unemployed. They do seem to be devoting longer periods to look for jobs, and that at the end they are getting higher quality jobs.
And so I just want to have a follow-up question on that. Thank you so much.
Yes.
It puts it a bit more in perspective. And it's also, I think, very similar to the situation in our region. But I was just wondering, so are you saying that the fact that the program, being part of the program, makes the participants who were originally a vulnerable or marginalized group much more focused on quality, and therefore they would risk a longer time without employment in order to find a better employment in the end?
I mean, I don't have a way to test that, but that's a hypothesis that we can think about, because there is some evidence in the, let's say, in the questions we included in the survey that show us that this could be happening. Yes, first, they do have higher expectations about their professional aspirations in the future. Second, they do seem to wait longer until they get employed. Third, they do seem to get at the end higher quality jobs. Now, I want to highlight that higher quality jobs in this context is only formal job. In our countries, informality is huge. Everyone works in the informal market. So high quality job doesn't mean here a magnificent job in a multinational or government. It's just formal job, so that they have a written contract and that they're getting health insurance. That's our measure, and that perhaps they're getting paid a bit more. That's our measure of quality in this context.
Yeah, no, great. Because the situation in many of the countries in the MENA region is that highly educated and relatively well-prepared young people, they are very selective in the type of jobs they take, while the lower educated or less educated, less prepared young people would end up either in informal or very, very low-paid jobs.
Yes, I don't know very well the MENA region, but what I would say is that the case of the Dominican Republic is it's very marginalized youth. It's at-risk youth. So increasing their expectations and making them aspire to a better job I wouldn't say it's making them worse off, because really just aspiring to a little bit more is still very few.
Thank you.
Yeah.
Do any other colleagues have any questions for Bibiana at the moment? You can unmute your mic and ask the questions. I don't see any questions. What I do know is, Bibiana, is that we will have more questions. What I will do is I'll share the recording with the colleagues and also give them an opportunity to raise. Oh, I think Bushra from Morocco is going to ask you a question. Bushra, go ahead.
Yes, thank you, Vera, and thank you for the presentation. I have a question and maybe something to share with you. The question is about the linkage with the employability actors, such as the ministries, but also NGOs, etc. Did you take in consideration other employment programs existing? And my remark also, it's on the last report produced by the World Bank, which is called Stepping Up Skills, which is a framework on the life skills and how to develop life skills in the different state age of childhood. And they noticed that the labor productivity depends on very high level cognitive skills, and I'm referring to the slide 11. As you said, maybe it's we should see 3 components of the cognitive skills, which are sorry, I'm on the 11th slide. The leadership, self-esteem, and ambitions. And the World Bank is more talking about analysis and problem solving and communication, which became very important in actual labor market, and also some behavioral skills such as discipline and work efforts. So what is did you also see other initiative and the linkage between with other life skills programs such as IYF or World Bank, etc.? Thank you.
Okay, so let me see. The first question, just to make sure, you were asking about how we worked with the private sector.
Not only all the employment actors, ministries of employment, NGOs also who are offering employment opportunities, but also private sector and the patronat too.
So this program was financed together by the Inter-American Development Bank and the World Bank. It was executed by the government. So, of course, all the ministries of labor and all the agencies related were involved. However, the training itself was not provided by a public agency, but by private providers that were, of course, approved by some public agency, the labor agency in the Dominican Republic. We did not, let's say, collaborate with any other NGOs, but I would say that perhaps the private providers had somehow of a structure of NGOs, given that they were always working in training for at-risk youth. So I don't know if that answers your first question. As for the second, yes. For the second question, I haven't read the World Bank report, but I would be very interested to look at it. I look forward to reading it. And I think that the issue is not whether cognitive or non-cognitive. I think that we have previous experience, a lot of experience with cognitive, vocational, with very limited results. And to the moment we started including non-cognitives, and things seem to improve a bit. So I think there's a lot to learn there. As I said before, we still don't know what we call non-cognitive, and there's a lot of research to be done in that area. The World Bank, as I said, they co-financed this evaluation, and the cohort that they worked with, they did something very interesting. However, the results of that are not yet available. They randomized into groups that had different training programs, and one of those training programs was only the non-cognitive skill training. So they were able to differentiate the effects of each kind of training, and what they found is that the effects remain the same whether you include or not the cognitive skill training. So apparently the cognitive skill or vocational skill training is not, in this case at least, doesn't seem to be adding much. Like all the effect could be attributed to the non-cognitive skill training. So I think that this type of research, where we could differentiate the impacts of the non-cognitive skill training, of the vocational training, of the internship, is very interesting and very valuable. Because here, for example, we cannot differentiate what is it that had the most impact. Was it the non-cognitive, the cognitive, or the internship? So evaluations where we could differentiate the impacts of these things, I think are very valuable, and we could learn a lot from those. And I'm glad the World Bank is doing also work on this, and I look forward to reading the report you mentioned.
Okay, I can share it with you and with
Great.
all the participants.
Great.
Thank you so much.
No, thank you.
Anybody else has any questions? If not, thank you again, Bibiana. I appreciate. I know it was very early for you. Sincere appreciation. I do look forward. With regards to, I had just one question. Who was the actual team which conducted the evaluation and the measurements on the ground? Was it IDB directly, or was it NGO partners? Did you train the NGO? Who actually did the measurements?
We're both World Bank and IDB. We designed the questionnaire, and for the collection of information, we hired, I think, a local firm, and of course, we supervised the work of the local firm. Yeah, I think that in this process of data collection, many times it is very valuable to have a local firm supervised either by the IDB or by someone that you hire to do the supervision and the quality assurance of the data collection process.
Okay. And so, but if you're looking at continuous measurement, and for the government, how were they planning to do it along the road? Because this is an ongoing program which needs to keep refining, strengthening the quality. Is it always externally funded through the IDB or World Bank, or did it get integrated into government process in terms of measurement as well?
As I said in the beginning, what we were lucky here is that the government was really interested in doing this evaluation, and they were very supportive. And if you even see the paper, some of the members of government are part of the authors of the paper. So it was a very collaborative effort. This program continues to be financed by the IDB. I think that with an important local counterpart funding. But of course, I think that part of the challenge here is for the government to assume the challenge of evaluating. And I think that in this case, we were very successful, and the program continues to be evaluated. Every round of the program is evaluated and improved, and I think that I'm not involved in the new round of evaluations, but I think they're precisely trying to test the different effects between internship and non-internship or stuff like that. So it's I think that the government is now like the first interested in doing the evaluation, and they, even if I think that if they didn't receive more funding from our side, it's so embedded already in the program that they will continue to do it.
Okay, no, thank you, thanks. But that's good to know.
And something about the cost of this evaluation that I find very, very valuable, like a very important learning, is that for the baseline, we almost didn't have any cost, because we used, like, the moment that the youth goes to the training center and asks for an admission form, the admission form is our baseline. So there we didn't spend much money. The money that we spent for the evaluation is in the follow-up survey, which is expensive because you have to follow up 2 years later on treatment and control. So it's not easy to find everyone, and you have to do some sort of intermediate follow-ups not to lose your individuals. But we were able to do it because we were able to save at the baseline. So that's also an interesting learning. Mm-hmm.
But I know I have read studies both from OECD countries, and what they have seen is there is impact over a longer period of time. So at the short term, even 2 years, you don't see an impact, but over a long term, if you were to do the cohort analysis, there seems to be an impact on the training, even on employability. Have you, is the World Bank in the current studies doing the cohort analysis for a 6-year analysis to see following training, does it make a difference if you were in the original pool or no?
No, unfortunately not. We are continue evaluating, but it's not like a panel. We're not following the same people during all the years. But we are considering in looking for administrative data like social security information, and trying to identify there the youth that were part of the evaluation so that we can follow them in the longer term, as you say. We won't be able to do it with survey information, so we don't have surveys for that. We only had financing for one follow-up survey, but we are trying to do it with administrative data. So going to the records of the social security system and trying to find whether people in the control and treatment groups are formally employed or not.
Okay, no, good. But thank you again. I really appreciate it.
No, you're welcome.
Yeah, I don't think we have any other questions. What I'll do is I will share the recording with the rest of the colleagues, and maybe as the questions come, I'll consolidate these questions and share them with you, Bibiana. Sincere appreciation, and if you have other tools, materials you think are relevant for the team, I'd appreciate if you could share them with us as well. Yeah, thank you.
Okay, Vera.
Yeah.
Thank you.
Bibiana. Thank you so much. Bye.
Okay, bye.
Bye-bye.